We hear numbers of 20 deaths per day, 30 deaths per day, and it gets really easy to get numb to those numbers.
That's why Dr. Neeja Bakshi, who works on the internal medicine ward at Edmonton's Royal Alexandra Hospital, took to Twitter this week to recount calling a woman to tell her her 75-year-old mother was dying from COVID.
As expected, she was very shocked and ended up hanging up the phone on me, which is very understandable.
Dr. Bakshi calls back. The daughter on the phone says, "I'm so sorry for hanging up on you. I was shocked. I didn't even know she wasn't well." The hospital arranged for an iPad to be brought in so the mum and daughter could say goodbye. But first, the patient asked for her lipstick.
She was just so insistent that she needed to look good when she died.
Dr. Bakshi says it was an emotional call. Eventually, she sat with the patient and the daughter on the iPad in silence for 30 minutes as the woman passed away.
It's a very weird feeling. You feel close to the family in that moment, but you also feel very distant. And as a physician or the nurse that's doing that, you are the conduit for the love between those two parties. And it's a great responsibility.
More than 2,700 people have died from COVID in Alberta since the pandemic began. Nearly 500 of those deaths reported in the past 4 months. Dr. Darren Marklin has seen many of those deaths working in the ICU.
We don't have good ways of predicting who's going to do well and who isn't.
We caught up with Dr. Marklin on his way to work. He says when someone is admitted to the ICU, they're put on a ventilator and then into a deep coma.
We see some people die very quickly. But again, when you get a young, previously healthy person, it can take up to 6 weeks, months sometimes.
He says they're seeing more and more of those patients.
And now, they're people like you and me. They are young, they're healthy. They don't have much else wrong with them.
Kim Smith, Global News.